Stop going to hospital unless it's highly required. Stop going to hospitals unless you need critical care. Stop going to hospitals. Stop going to Kenyan hospitals unless you really have to go to those hospitals. Why? Because the Kenyan healthcare systems, Kenyan doctors, Kenyan hospitals, especially private hospitals, are killing our people. And we can't tell if it's out of ignorance. We can't tell if it's out of malice. We can't really tell why. Because I need an answer from doctors. Kindly tell us why we are still treating cases like cancer, diabetes, the same way we did like 50 years ago. Why are we still issuing high blood pressure medication, especially for borderline diabetics? Doctors, tell us why you can't treat trivial conditions as UTI. Tell us why you can't permanently fix or cure H. pylori. Doctors, tell us why. Why can't you allow us to do our work as preventive practitioners, to try and sensitize and to pass that information that is the diet that is killing our people? Are you cashing out from their ailments? Tell me why. Borderline diabetics, I'm repeating, tell me why a borderline diabetic requires medication. Well, it's as simple as sending them to a nutritionist, because that is not your area. Tell me why I deal with 10 clients per week who have UTI, who have had UTI for the longest time. They've gone to the biggest hospitals in this country, and I'm not scared to call the names: Coptic, Kenyatta Hospital, Nairobi Hospital, Aga Khan. And they haven't been cured yet. Dealing with the biggest and the best consultants of the country. Why haven't they been healed? Tell me why we have issues of erectile dysfunction from men as young as 24, 25, 26. Tell us why people as young as 28-year-old women are going into premature or early menopause. When we are here telling people stop using family planning or use it at your own peril, knowing that it might lead you to an early grave, or it might cause things like infertility. Why can't gynecologists? Why can't physicians? Why can't COs? Why can't nurses tell our people this whenever they go to these facilities to get these family planning methods? Why are we dealing with the symptoms? Because from my end, cancer is not a disease. Cancer is a symptom. Why are we treating diabetes the same way we did it 20 years ago with all the information we have currently? Who is gaining? Who is gaining from this scheme? Because it's a scheme. It's a scheme. It's a scheme to benefit from sick people. Why has somebody used like 4 million in 2 years trying to cure something so trivial, and it's only 2,900 shillings that we require for him not to hear from us ever again? Doctors, kindly tell us, you're the cream of the cream, creme de la creme. You're the most intelligent. According to the system, you are picked from the best of the best. Why can't you give us tangible solutions? Or are you gaining from people being sick? Are you really gaining from people being sick? So Kenyans, we need you to open your eyes. It's 2024. This is an era whereby we have all the information you require. It's a click away. You can go to TikTok, you can go to YouTube, you can go to Google. Stop taking blood pressure medication. If you haven't started, don't start. If you have started, try to find a way to stop. Because I know they don't tell you these things. They lead to neuropathy, they lead to kidney failure. The quality of life is pathetic. So when we tell you seed oils are bad, your doctors will never tell you this. When you tell you sugar is bad, your doctor will never tell you this. When we tell you wheat is bad, when you tell you alcohol is bad for your health, they won't tell you this. They'll try to fix the symptoms, which is diabetes, high blood pressure, cancer. That is what they'll be so quick. And they are so quick to fly into action when you get that cancer diagnosis. Oh, we have to start chemo, you have to go for surgery. They're so quick to come in. Why are they not as quick to come in with preventive measures? So use your common sense. Just use your common sense. People with UTI, people with H. pylori, people with diabetes, cancer, the list is endless. Ask yourself the questions. Are there alternative medicine methods to fix your issues? So we are not scared. Come with the threats. We know we are getting the threats. Come with the threats. We'll not stop. In fact, we are just starting. Come with the threats.